that the stuck energy almost has a more profound impact on dysfunction in the body than just a bone out of place.
Welcome to the Hey Mama podcast. We're your hosts, Tessa and Shayna. We are sisters, mothers, and doulas and are passionate about living an intentional life and all things motherhood. This podcast exists to create community as we learn how to delight in motherhood together.
Join us weekly as we chat with women about anything and everything from non-toxic living to women's health to feeding our families and our favorite topic of all, birth. We are so glad you're here.
Please keep in mind the views of our guests may not necessarily reflect our own and vice versa.
This is not medical advice. We always encourage you to do your own research and make an informed decision. Let's get to it.
Well, hello. We are so happy you guys are here with us today. We have a lovely, wonderful guest today that we are very excited about, Dr. Nicole. And Dr. Nicole, if you wouldn't mind, would you just tell us a little bit about yourself?
Hi, I am Dr. Nicole. I own Inspired Family Chiropractic in Santa Clarita. We are a neurologically based chiropractic office that specializes in babies and moms and families, and we pretty much just have a blast seeing kids all day long. And yeah, we're celebrating 6 years in August, so it's kind of still new, but also feels like a really long time, and so it's kind of my baby in progress.
Amazing. And you have another baby, right?
I do.
Tell
I'm
us
a
about
dog
that
mom.
baby.
Everyone always asks me if I have kids, and I'm always like, no, just Archie, which Archie is our office mascot. So he is a golden retriever that's in the office every day. Luckily, I have only dog people that come and see me, and that if they're not dog people, they say that they're Archie people. So yeah, but I mean, I always joke that the hundreds of kids that I see are like my adopted children that I could just give right back and not have to do all the hard work. But
You're like the world's best aunt.
Yeah.
You make them happy, you soothe them down if they're crying, and then you just kind of, okay, send them on their way. Yesterday when I was seeing Dr. Nicole, because I attend and I'm a client of hers, but yesterday I was just watching this woman, like truly, like just loving Archie, like he was a human baby boy. And she was just, and I was next in the room next to her, and she was just going on to him like, oh, you sweet boy, you look beautiful today. Like, look at you. Look. And he had his paw like on her, and she was like, they were like hugging basically. And I'm like, I'm sure you know the lady who I'm talking about, but it was just so funny. So like, wow, these are such intimate moments are shared with Archie.
I know. And what's so funny is everyone is always like, oh my gosh, how did you train Archie? He is like such a good dog. And I always laugh because I'm like, his office persona is like totally different than how he is at home. Like if he were here right now, he'd be like here, like he'd have to be in camera. He had to get moved elsewhere because he's a little bit of a riot at home. And my friends will always be like, can I get that inspired Archie greeting, not like the normal Archie greeting? And so it's just funny because he just knows that he's there to work and he's there to love people, and he has like a totally different personality at inspired versus home. So
that is hilarious.
He's a riot.
That's so sweet though, because even our friend who was going to, she was like, I don't even like dogs, but I love him. Like I'm obsessed with him. And like she's like, I think he's an emotional support animal. I think he was like supporting me. And we're like, I think he could be whatever you need him to be.
Yeah.
He's an empath.
Well, and he's like trained by all the people that come to us. So it's like we used to have like rules, like Archie rules, so that way everyone would like tell him the same type of commands. And so they're like, you had to have had therapy training for him. And I'm like, oh no, it's all an act just here.
It's all an act. I love when you said he comes to work, he clocks in, does his what he does. I give him money for it, and then he comes home and he is just another human being.
100%.
I love it.
100%.
I love it. It's so good. So good. Amazing. Yes, you do. All right. So we thought that you have such a just specific type of care that you offer, and it's very different than just the general, I like to say the snap, crackle, pop kind of chiropractic care that a lot of people think of when we even suggest like, hey, have you considered going to a chiropractor? And then immediate response might be, oh no, actually I don't believe in chiropractors, or I know someone who had a chiropractor injury, something like that. And it's just these extreme like thoughts. So tell us a little bit how you are different than that like initial thought that that's what someone thinks of, is that corner chiropractor spot, you know, that people go to when their back hurts. How are you different?
Well, for one, the application. So the technique I practice is called torque release technique. So it's all instrument based. There's no manual twisting, cracking, popping. And then obviously Webster is the specific prenatal technique as well. But torque release technique, I was kind of like thinking about this, reflecting on this morning, of sometimes we can get so caught up on like the application of chiropractic, of like how I'm adjusting that makes it different. But really it's like the analysis and how we assess and what the bases are. So a lot of the foundation of my office is nervous system centered, meaning that rather than just looking for where there's like a stuck joint or an issue with joint mobility at the structure, I'm really analyzing where are there stuck areas in the nervous system. And so that's how our results are so different. I see such a wide variety of things because, you know, when you look at all the different anatomy charts that are so like all the pathways of nerves, I mean, we all know we just have so many millions of nerves that our brain supplies every function and every organ. You know, but those roadways can get stuck. They can have limited fluidity. They can have like roadblocks, like you would think of like traffic on our freeways in LA. And the more roadblocks there are, the more dysfunction there is. And so the application addresses that neurotonal presentation, which is just those roadblocks in the nervous system. It's where the nervous system is stuck. And so, so that is, you know, what people think is like, oh my gosh, you don't do any twisting, cracking, popping, which honestly puts a lot of people at ease. And I will always say this, I don't think that it's bad. I don't think that it's dangerous at all. Obviously, I was trained the same way as every other chiropractor. But it is a lot more gentle. It is a lot more specific. Therefore, our results end up yielding different results because of the specific analysis as well as the gentle way of adjusting.
I love just how you mentioned like the highways or like a freeway, because that was such an easy way. And when I was starting to like learn to understand more of the Webster and like this way practicing, it was that it's like, okay, it's a freeway, like your spinal cord's a freeway, right? And then each highway or exit, right, it could be blocked, right? And then that is causing maybe dysregulation, or that's causing a blockage in this, and this is now causing constipation or, you know, migraines and tension, blah, 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 blah. Right. So I think that's just such a cool visual for people to kind of like have, oh, okay, like it all works together, obviously. And you have to kind of have that open mind that like, oh, the body is whole, that works fully all together and everything affects the other. Right. And so if you don't have that, that's kind of hard for people to probably grasp a little bit. Right.
And for a long time, I feel like, you know, the average chiropractic office explained, you know, that kind of pinched nerve, that there's pressure on the nerve so the brain's not getting passed. And so you can still kind of lump it into the same analogy. But I think the more and more research we do of just how stress affects the body and how it affects, you know, development in pregnancy and how it affects outcomes of birth and how it affects even development as a kiddo, it's not a structural stress really, because kids don't have structural stress. I mean, we don't, babies are barely developing curvatures, right? So when we're talking about some of these blocked nerve ways, it's not necessarily like that pressure on the nerve, the bone moving out of place that needs to be moved. It's more so that stress has like absorbed the system, and there is, you know, so many different tones and layers of the spinal cord, like fascia. I always say it's like plastic wrapped around the spinal cord. That's really what fascia is, and the tones that kind of wrap those meninges, and even the, you know, then each nerve has a tone, right? And so that's what I mean when I say neurotonal, is that the stuck energy almost has a more profound impact on dysfunction in the body than just a bone out of place. So because the way I already adjust is a tonal application, that instrument is all based upon physics. I've kind of just easily, you know, manifested into this nervous system centered office. You know, and then someone like Dr. Courtney has taken that information to the masses, which is amazing, because she obviously has the platform to be able to share that. And so those are keywords that people are now understanding, and they're understanding things like fight or flight, and they're understanding, you know, the difference of like all these different stressors that the nervous system can carry and how that actually impacts their expression of health. And so, And so, over the years, I've learned to train with different people that specialize in this, which naturally has redirected seeing some of these more special cases that we get to see.
Yeah.
So cool.
That is so cool. And I love how you explain that it's like blocked energy. It's literally causing then a blockage in the nervous system, causing then, dysregulation or whatever it may be, and how it manifests itself in the body. I think that's so, we see that so much with mamas who have a baby and there might have been little birth trauma. And we always encourage, like, go get body work, because that helps in that process. There's so much obviously that should be done in the midst of that, but body work can help because it does help with that regulating the nervous system. I just love that. Yeah. The blocked energy, it causes stress on the body, and that's huge.
And so when you too, just because I know it's kind of like this small percentage of people who know about Webster Certified and what that actually means. So if you don't mind just kind of laying it out for our listeners, like, what does that mean? And then why is it beneficial to mamas? Because you say a lot of mamas, like you're saying, and babies, obviously, and there are families involved and men, but that's the majority of your caseload. And why is that you're really using that method?
People are always like, do you even see men? And I'm like, I'll see the husband. Okay.
Right.
You have a couple like lifers, I feel like, that I'm in there, and like they're these older men and they're just the cutest and they're in love with her. They all give her big hugs, and I'm
Dr.
like,
Nicole.
that's so sweet. I'm not giving her a hug. Should we all be giving hugs here? Do you want a hug from them?
Do you want to?
But they all give her hugs. Literally. Anyways.
That's it. I have so much fun in the office. We're having some kind of funny banter every time I see her. We've established she's VIP, although she doesn't always feel VIP, but she totally is.
Okay, go back to it.
Okay. I'll talk about it.
Okay.
So Webster is a technique that has honestly been around for quite a while. I mean, the founder of it recently passed away in the last few years, but she's been in the chiropractic profession for over 30 years, I would say. And it's specific to aligning the pelvis and checking the ligamentous structure around the pelvic area, but also the attachments to the uterus, just to reduce and release any tension. So part of it is neurologically supportive, and the other part is strictly like that joint mobility, making sure that the pelvis is moving well. And so Webster's done a lot of research with just in improving birth outcomes in terms of like the decreasing labor pain and delivery time, potentially decreasing likelihood of breech presentation, decreasing likelihood of intervention. And really why that is because obviously I don't need to tell you guys that the pelvis is moving more than it ever will until you have another baby, right? It's like the pelvis flips all the way out and the sacrum flips all the way back, and then that's what creates that birth. I always call it the birth canal inlet, and I always like show moms this, and their eyes are always like, oh great, that's a visual. But that's essentially what happens for a baby to come earth side, right? And so the better movement and symmetry on both of those bones each side, the better the outcome, right? So the body works in coupled movement and coupled function. If one thing moves, it relies on another. So like there's no part of our body that can just move without it being coupled with another bone or joint. And so when the sacrum and the pelvis move, they're reliant on both sides of those joints and of those bones to move properly. And so Webster is checking for any posterior rotation of the sacrum, which just meaning that it's rotating backwards on either side, or anterior rotation of the pelvis and compensation of that. And so it's a specific way of adjusting either the sacrum or the pelvis to create alignment and balance there. And then there's a lot of ligamentous checks I do. So the biggest joke in my office is that I do, and this is exactly how I explain it. I'm so sorry if this is inappropriate, but I'm just going to tell you how it is. But the sacrum tuberous ligament attaches between two bones on both sides. And that's literally my thumb. To check that is my thumb like right up next to the butthole. And I'll always tell moms this. And I'm like, don't worry, I won't do it the first time I meet you, but we will do it the second. And they always laugh because they're just like, I don't care. I've already had kids, whatever. But that is a release of the structure because that attaches to both the sacrum and the pelvis. But it's also a neurologic epicenter for the parasympathetic system. It's so fantastic for moms to take their body out of sympathetic dominance, to give a little release and some attention to the parasympathetic system, just because that's the very tail base of all those parasympathetic nerves joining the vagus nerve as everything kind of connects together. at the bottom. And all of that's obviously what's supplying reproductive health. And so development of baby is reliant on that system having good harmony with the sympathetic system. And so that is a check I always do. And then I check the piriformis muscle, I check the pubic symphysis when necessary. And then I do a lot of round ligament work. So the round ligament is the only ligament in the body that has muscle fibers. That's what allows it to stretch to the capacity it does and then shrink back down to where you can't feel it. And so like any other muscle fiber that is under a lot of load of stress, those fibers can contract and they can hold stress or tension. And what we know at like layman's term is that we'll feel like knots in our traps or knots in muscles or whatever it is. And so that can happen on a really micro level in the round ligament, and releasing that not only allows for comfortability on the front side, but it allows for alignment as things move forward, which really is why we get so much result and change with breech, because breech is usually baby doesn't have room or there's misalignments or maybe it's brain body connection. It might be a wide variety of it, but why Webster's so successful with that, I think, is a lot of the round ligament work too. Just because if one side's contracting muscle fibers and the other side's not, the limited mobility on one side versus the other can start to kind of affect baby's position. And so those releases end up being really powerful for just giving baby space to go head down. And we have a super high success rate of breech no longer being breech. But I always tell moms, baby knows best. Baby knows more than me, knows more than any other doctor, knows more than mom. Maybe, that's a maybe, but their intelligence really is so strong. And if they choose to stay in a breech position, I always encourage them by saying, like, it's usually for a good reason. Like, you have to trust their innate intelligence in it too. And so maybe they're protecting themselves of some sort. If you're doing everything you can to support your body and position stays where it is, it's probably for good reason. Because ultimately, you know, we can do all we can within our control, but the actual outcomes of birth are largely out of all of our control. I mean, I don't need to tell you guys that. I always feel so funny talking about these things because I've never had babies.
But, don't feel silly. You see it every single day.
And it's so cool that you're encouraging mom. But I remember you saying that. You said that to me and before when we were talking about breech, and I think it's super interesting. I love that you kind of just give it like, you know what? Like, yeah, we can do all that's in our control and try so hard, but actually baby does know, and that intelligent design, that baby knows when to turn, how to turn, the carnal movements of birth and everything that no one had to teach them how to do it right. So yeah, I love that idea that like, yeah, they might be protecting themselves from something and they do know the timing. I think that's a really cool thing and kind of, you know, encouraging to maybe a mama who does have a breech baby and just knowing like, okay, my body and my baby do know and they can work together.
Trust the process and trust your baby. I mean, that's what we encourage so many mamas to do. That's all you can do in that whole process of birth and labor. Like, your baby knows how to be born. Your body knows how to birth this baby. So I echo what Tessa said. That is an encouragement for sure. So like, just trust this process. Baby could turn at 41 weeks. You know, you have no idea. And then they're like, now I'm ready to be born. Let's get this party started. That would be wild.
100%.
Well, in line with that, because you kind of went over prenatally, like with the benefits, what would be a reason to encourage maybe to see a mama postpartum, to see baby? What are some reasons why Webster certified nervous system centered chiropractic care could be helpful in that season?
I think a lot of it is really, you know, obviously the change postpartum is some of the biggest steep changes hormonally that happen, the body trying to heal. Like, really healing postpartum is like an open wound that's going to require a tremendous amount of healing because that wound was open for a decent amount of time, 9 to 10 months, obviously, for most moms. And so, you know, so part of it is the structural component. I always say your pelvis opened and then it came back together. But hormonally, there's a lot of benefit of getting checked postpartum because you still have the gift of relaxing and the gift of kind of some wiggle room in the pelvis to give some good change, and the body's not as stubborn as it is when we don't have those type of hormones kind of giving our ligaments a little bit more love. But also the tender care of the nervous system in that time. Sympathetic dominance is like across the board in society today so normalized in term like, and that's just meaning not to say people think that like it's okay to be stressed all the time, because I don't think that we do. I think we're trying to like challenge that. but we've learned how to live in sympathetic dominance. And so moms, like your life is going through a rebirth. You're keeping a human alive. Your body is changing faster than you can keep up. Hormones are not working for you. Plus, your body's probably fighting a little bit of the sympathetic dominance, especially if birth was traumatic, or especially if birth did not go according to plan, or whatever the situation may be. And so that care for mom, I think in that time frame is so supportive, because it's I think it's becoming more aware in terms of discussing like and normalizing like postpartum depression and postpartum hormonal changes, and all the things that moms feel when they're transitioning to have those moments are like totally okay. Because to this point, I think it was largely not talked about, but the nervous system has absorbed a lot of stress of that over generations. And I think that moms have just put on the backpack of everything and manage everything, and something's got to give. The body eventually can't adapt. And so the benefit of care isn't just the structural healing. That's a huge benefit, of course, because adjusting during that time frame maximizes the healing process. But the benefit to the nervous system is that you're not, I always talk about like stress patterns kind of like filing away, like this concrete of like our body will learn to adapt that way. And so changing it from the get-go of how your stress can, like how you mother, how your nervous system adapts to mothering and everything that's happening with baby. There's so much benefit to rewiring the nervous system in that time frame as your body is learning to adapt and giving it that extra support. So that's a huge benefit for moms. And then for babies, they're so connected to mom's nervous system. And most of us are birthing babies with a little bit more sympathetic dominance, just because that's kind of, like I said, we've all learned to function on high stress,
right,
and do it kind of seamlessly.
It's kind of a medal, like,
for
oh, you're
babies,
so stressed. Yeah.
Or, oh my gosh, we're handling it all. And
Yeah.
we don't look like we're stressed at all. Like it's
Right.
just easy. We're handling it, no problem, you know? But our bodies do memorize that response. Our bodies do absorb the stress somehow. And that's where we start to like get into the neurology of like, where does that stress settle? And it's in the nervous system, it's in the pathways, it's in the nerve pathways. And so for a baby that's born in sympathetic dominance, how that affects them is that they're in a state of protection rather being in a state of growth. So if you can't be in both systems at the same time. And so if babies are being born in a state of protection, things that they're not going to have they're not going to have the easiest ability to do, which should be instinctual, which is sleeping, eating, and pooping, all those things suffer. And then that gets added on, and then development delay gets added on. And then it becomes one thing after another of kind of what we're seeing with kiddos. And that's really just coming from like the nervous system learning from the get-go, or even in pregnancy. If mom had a stressful pregnancy because her life is stressful, or job, or whatever it might be, that's a memorized stress response before they're even earthside. And then to try and adapt how that gets harder and harder. And so that's why we see kiddos with all kinds of things.
Yep. That's such a powerful thing. And really, I mean, and moms can be really hard on themselves for that. Just that what you said with like, okay, could have started in pregnancy.
Yep.
And I think that's something that most of us wouldn't even have considered, like, oh, well, no, they're a clean slate when they come out. Like, I haven't done anything to them yet, but actually your body is so, again, intelligently designed that it does have that power. And that's just kind of wild, and also like a little daunting, like that, like, you have to be intentional from the start of like, conception, that like, it's a big deal.
Yep.
It is. And
it starts right then. And that is so powerful. I think that was huge what you just said, and so important for moms here, for me to hear. Like I was like, yeah, exactly. Amen. Like that's so true. And I love that. I was just listening to something of babies, they literally mirror us. So if we are dysregulated, and you already know this, I'm not telling you anything new, but like if we're dysregulated, if we're in a constant state of fight or flight, if we're stressed all the time, if we are expressing ourselves, whether or not we realize it, our babies are literally watching, and that's our posture, like everything, they're little mirrors to us. And so if we're feeling dysregulated, pretty much 9 times out of 10, your baby will be feeling very similarly. So I love that mama baby care, whole family care, and that holistic approach of like, you're not just looking at, oh, your pelvis is a little out, you're 1 inch, higher on one side, like let's get that done. Like you're looking at the entire form and how everything ties together. And then also looking at baby. How do you see that with breastfeeding and all of those, like what you mentioned, the things that are innate within us, so pooping, sleeping, and eating? How do you see that then once, maybe like in a case where baby came in, mama came in, and it was an extreme, and then care started, and how does it go with that?
So, depending on what they come in with, I mean, breastfeeding and issues with latch is probably one of the most common struggles. And I think part of that is there's a lot of pressure around breastfeeding. It's like there's all these ideals that women are trying to like live up to. But also, too, there's a lot more awareness around ties and how that impacts, the ability to latch and all the things. But the cranial component is all the spinal nerves that control all of that. And so if the body's in a state of fight or flight, the vagus nerve exits up at the top bone, and that is the most dominant like part of neurology in an infant because that's what's building the parasympathetic system. And so when the body's in a state of protection, that's going to kind of be in a state of freeze. It's going to be down regulated. It's not going to be able to kind of like have this. We use the comparison of gas and brake a lot, of the ability to know when to have our foot on the gas and react and respond to stress, and when to be on the brakes. And most kiddos are like on the gas pedal from the get-go. And so all of that plays into it. And so the adjustment, it's a combination of mobility. If there's more tension on one side of the neck, which that could be either from birth trauma, or that could be from just even kind of being in the same position in the womb, or if if they don't have that mobility, part of it structural, but also part of it's neurologic, that's also going to impact preference of latch one side versus the other. And so it kind of all gets dumped into the bowl of like adaptability is what I always bring it back to. It's like, when they're not in this like fight or flight state, they eventually can figure it out. But the care is supportive to taking them out of that, along with one of the biggest bones I'm adjusting on infants is the atlas bone. So it's that top bone that cradles our brainstem. It's our major rotator. It's how we can get our nose over each shoulder. But neurologically, it's the starting point for development of everything. And so one of the first things innately a baby wants to learn to do is to feed, right? That's one of the first things they want to do as soon as they come earthside, is to get that nutrition supply established. And so the frustration that comes when that doesn't happen instinctually or innately, it's not even just, and then mom's stress, right? Like they feel mom's nervous system, and if mom, it's a domino effect. And so the care, I mean, we get changed pretty fast with that because of the neurology side of things, but also just even baby being able to have the freedom to look side to side in itself makes a difference. And so it kind of all works together to support that. And then everything else begins to kind of improve from there.
It's true.
It is.
It's true. Just my baby. Week by week. coming to Dr. Nicole. Just a lovely, beautiful experience. And truly just seeing those wonderful changes. Like just and like I'll be like, telling her like little wins, like he's doing so much better in tummy time. He is not really having a preference from side to side. He's not only turning his head over to the left every time I lay him down on his back, right? And just these little things that should be just totally, evolving smoothly, but he needed a little bit of help, and you've been able to assist in that. That's so cool. So really love that. Okay, you kind of touched on breastfeeding and that. Is there other ways, even outside of that prenatal and immediate postpartum world? Because we already know, obviously, you are helping people all day, every day, which is in that world. But outside of that, let's just say you have a toddler who's maybe 2.5, and or these different disorders or ear infections or just chronic sickness, chronic stomach ache, maybe even special needs. I mean, migraines. Like I know there's a whole slew, obviously, of things that you are helping people with, but maybe just give us a few examples of this. Like, okay, I had this case or this client or this kiddo, just that you've kind of helped or seen changes in of just by having nervous system centered care.
Okay. So I'll give you a general example of what we would call like an intensive case. So that's going to be kiddos a wide variety of ranges that are either autistic or having ADD, sensory disorders, developmental delay. Those would be more of our like intensive cases. And I do see a ton of that. And as we talked about, like kind of the foundational stuff of like all these stresses layer. So this is what we call the perfect storm. And I actually do training with Dr. Tony Ebel, who trains docs called pediatric experienced chiropractors. And there's a kind of like Dr. Courtney has a database of nervous system care. He has a database of people that have intensive cases that they could find chiropractors that have very specific training clinically to be able to be supportive to help cases like that. And so the team and I mean, my girls train with me to learn all this stuff that sometimes they're just like, am I like in school today? And I'm like, yes, you are, because it's a complex thing, right? We're seeing kiddos with all different types of things, but these are the kids, they're in OT, PT, speech, they're literally doing everything. And, the first step that we do is we assess the nervous system with our technology. We use Insight CLA, which is measurements of how the nervous system is functioning, where it's not adapting well, where it's holding tension. And we're able to facilitate 2 different types of assessment tools to kind of see where their nervous system is at. And then we adjust them the same way I do adults for the most part. I'm just not really doing a full Webster check, but I still kind of do pelvic drop table with them. And then I'm using torque release technique. And the results that we get, it depends on the age. I mean, developmentally, there's certain age ranges where you have availability to continue development. So say it is more 2.5. There's a lot of room for improvement of like to get out of the regression state and get back into progression, where developmentally they can make up for some lost time. But I do see kids that are kind of 7, 8 and older. And a lot of that at that point is cognitive development and stress adaptation. And so one of the biggest things I think we see in cases like this, if they're nonverbal or if they're not sleeping well, a lot of times they'll have poor digestion. So as we talk about a baby in protection, like in a state of protection and not growth, those are the main things that suffer. A 7 and 8-year-old, same thing. If they're in a state of protection, digestion's usually pretty poor. They're not sleeping super well because their body's just sympathetic overload is like we're running from a lion all the time. Like that's the easiest example to give. And so these kids are gas pedal all the time, and their nervous system never has the opportunity to learn when to break and when to go. They're always on go, which leads to pretty severe neurological exhaustion. And so these kids, get more of like an intensive care plan. I might see them more frequently than the average kiddo. And we begin to create change. And what's amazing is that, they do see developmental improvement. They do see that all the other therapies that they've been doing for years actually become more beneficial because their body's adapting so much better to that application. And that's really what it comes down to. And that's what I talk with parents. It's not that, and I always say they're not broken. We don't need to fix them. It's that we just want to maximize their potential to adapt, right? How do we make their body's ability to express as best as it can be with what they have right now? And that depends on the age. Like there is some limitations the older they get. But those wins of being able to sleep or poop without having to take like enemas or like the amount of things that parents go through in some of these cases is just wild. And so those wins are really what become life-changing care. And some kids who aren't walking or crawling at 2, they begin walking and crawling under care, right? It's like at some age, it's never too late. But in a kiddo who's maybe not so intensive, rewiring that stress pattern at that age will forever change the trajectory of their health in the future, because that's the time to do it. The more memorized the pattern is, the harder it is to break. I always joke, I'm in therapy once a week, and I will be for years to come because of stress of my child. I always tell my parents, I'm in therapy because of you. But the truth is we have more resource to create a change, and that's why even going back to like, I would never ever want a mom to feel ashamed if her nervous system response is being mirrored by her baby, because to some extent, we're just now really talking about this stuff. We're just now giving resources to say like, hey, this is different. 2 generations ago, this was never talked about.
Right.
And so we're trying to break those patterns now,
Exactly.
Hopefully that answers your question. I feel like I went a little bit. I get really passionate about these kids because
I love it.
Yeah. I love it. I think that's something that's really stood out to me about your care and your office in general is just that it, because I've worked in speech therapy for years as well. So just kind of
Mm,
seeing that and that you brought that in of just working with kiddos, with just, special needs across the board with anything. And again, just even the most basic, because I'll be working with moms who, yeah, their child hasn't slept through the night since they were born and they might be 8,
mhm,
right? And it's just like the exhaustion you see. So when your child starts to sleep,
mhm.
that doesn't even just start to help, the child just developmentally and sleep
Right.
and all these other things. It helps then the parent, and then they're starting to feel
Mhm.
actually like, oh, I can maybe handle life a little bit more just because now we're all sleeping. And
Right.
then let's face, yeah,
Yeah.
digestive issues and all these other things. And then let's face
Mhm.
the different disabilities that maybe they might be dealing with. So I just think it's so cool that that more collaborative style care of, okay, you're bringing in just help for the people who like need help most. Like any parent with a child with just with special needs is like your heart is just
Yeah.
broken, like for them, because you just see everything that they're doing and they're so faithful and but they're
Mhm.
also like strung out. Like they're so just thin
Mhm.
with the fact that like, their resources. And I know I've seen parents over and over who've had to quit their job or they're taking leave, for a
Mhm.
job for 6 months while they start,
Yeah.
ABA in their home. And so just knowing that, yeah, you could assist in that in such a different way that again is so like in all my years of speech therapy, I've suggested it to moms of like, hey, have you ever thought about blah, blah, blah? Have you ever thought about a different diet? Have you ever thought about chiropractic care? And it's just not something that's even talked about or even given
Yeah.
as like a solution. Like this could be something that actually benefits their nervous system. Like, let's try this.
Yeah.
Yeah.
And
Yeah.
I think it's a really neat aspect of your practice.
I was gonna ask, like, because exactly what Tess said, I've never, we can suggest it, but I have never actually known someone that is going through this journey with their child or
Mhm.
with a special needs journey, and they're seeing like a chiropractor like you. How does that even,
Yeah, how
are
are
you
people
working in
finding
collaborative
you?
care? Like, how,
Yeah.
because that is not something that you hear
A
for the
lot.
majority of cases. Yeah. So I love it. I'm like, yes, but how do more people find out, more parents?
It's hard because I think that it's not, and I laugh about this because I truthfully don't know how some of these families began to find us because I wasn't being referred by either the OTs or the PTs or the body workers that do a lot of like the myofascial therapy and all the other things. Um,
Hmm.
but it started with a few families that had special needs, and I think they saw my Instagram and
Hmm.
they came in, and then that community is so well
Hmm.
like connected to
Connected.
one another for
Yeah.
resources. And so then and then it just kind of became like more and more. But I do think Dr. Tony Ebel has a pretty big following to where I'm having more and more people that are finding me on that
Okay.
inquiry website. And what's interesting is even in the last month or so, one of the pediatricians, and I'm blanking on which one, but local to Santa Clarita, because I've honestly never had a pediatrician really refer to me either, which is just
Right.
kind of wild because I see so many kids. Like
Right.
we work well with the midwives, the doula community, all of that. But
Right.
even like Dr. Chelsea Pinto and Dr. Bethany, like they're not in Santa Clarita, but they're
Right.
the first to refer if they think body work is supportive.
Right.
But a pediatrician asked for a stack of my cards because he couldn't believe the results we got on a kiddo that he thought was too old to see any change with head shape and thought for sure he would need a helmet for like, I think they recommended like 24 months. And then 2 months, he barely, it's not even been 3 months under my care. And he like couldn't believe the change because helmets are also like we're just putting them on everybody. And I think clinically sometimes they're totally necessary, but this is a whole nother layer of stress on that baby's nervous
Right.
Hmm.
system, on their structure. Like it's a whole nother world of kind of what we're trying to normalize. And so I think slowly the results are kind of showing for themselves, but there are good resources. The Perfect Storm is like a branded workshop that really teaches how chiropractic is so supportive to these perfect storm kiddos, is what we call it, which is the perfect storm of everything that eventually leads to the manifestation of something sensory or autism or whatever it might be.
Hmm.
And that's something that eventually I would love to host in my office. Like I said, me and the team have
Yes.
been doing some pretty intensive training, um, but there's a lot of work to be done around getting that information out, because unfortunately, the average chiropractor is not the best on educating to the world on what they do and how they do it. And so we're trying to like build that good rapport for as a profession. I think a new age of just marketing and that kind of thing, and Instagram and social media, but it's very new in the work there of actually starting to get that information out, but it's happening pretty organically. Like we haven't really had to try, I know, in my office. So
yeah, that word of mouth, those families and communities, that's huge, and that connection point. But it is hard because I feel like on, one hand, it still seems very woo woo, like, oh, like you're going to see a chiropractor, like, okay, like I would never do that, and it's like, how is this possible in 2023 that you still have that belief, or you still have that
I
thought?
know.
So that's interesting, because I feel like that the special needs or the autism community, I feel like that's pretty hard to kind of break through doing an alternative route. And I just love that you're seeing kiddos and that the families are being seen, and that there's just that little change, those little steps in a different direction, in the sleeping and the digestion. Like that is a huge win. So I'm so what a blessing you are. What a gift. And that's huge.
Thank you.
You are.
I think
You
the
are.
parents also just want more, I think we've seen it long enough around that we're realizing that like there's got to be more, because we can't box in how we approach these kids. Not every kiddo is the same. How they got there is not the same. And we pretty much have the same recommendations like across the board for how we treat kiddos that are having those delays. And so I think it's the parents that are like, cry for more, and they're researching themselves and they're investigating. And so
it's huge.
Which is powerful, because I think the more informed and empowered parents feel with their health choices, the more that's really trajectory shift of the future of health, is going to be a generation of people that are seeking and they're making empowered choices, rather than just feeling like, nope, this is the way we do it, I'm not going to ask any questions.
Exactly.
Which is exciting. It's exciting for us, because we all are pro empowered, informed health decisions.
Yep.
Yes.
100%.
Seriously, at the end of the day, I'd say it's probably interesting too, just for you. I'm just bringing it up, so sorry. But just with post-COVID, and for you, just kind of having all these kiddos, I'm sure you're seeing just kind of interesting things arise just from those 3-year-olds that are, they're all like 3 now.
Yeah.
And they're all born in COVID, and just seeing that. Yeah, you do.
Well, and
with like
I'll
parents.
talk about that with parents. Oh, totally. Because I'm like, regardless of where you fell on how your experience in COVID was, it affected everybody's nervous system. It changed the game for everybody. Kiddos, whether they wanted to be or not, got pulled out of a normal environment. No longer had, like, social development really happened between, like, I'm visualizing a graph, but between like 24 months into approaching year 6, 7. That's really where that social capacity comes. That's why kiddos with autism, when they're past that, the social growth is harder. The cognitive growth ends up like the ability to focus, to learn things, those kinds of things. But social, meaning speech, listening, eye contact, all that happens pretty early. And it affected everybody, I have a kiddo that, just to give you a quick example, I saw him and his brother pre-COVID, and they were much younger. And post-COVID, just came into my office this year. And the younger son, who had no symptoms pre-COVID, I was seeing his older brother for like digestive support. Parents brought him back in because they just were like, we don't know what to do in terms of like emotional breakdowns. Can't adapt at all. It's like if he loses a game, just like outroar. Like they were like, we just don't know what to do, and we didn't know who else to bring him to. And so we do an assessment. His energy outputs are off the charts when we do those nerve assessments, and so that his body was holding so much neurologic tension. And he's been back under care for 2 months. And it is like night and day difference of the kiddo. And they're like, we don't know what happened. Like, we don't know how his body had just got so stressed. And I'm like, it seemed like he handled COVID fine. But I'm like, it changed everybody. Everyone operated from a state of fear, which is the sympathetic system. Everybody either was fearful or angry. Like everyone had a very extreme sympathetic reaction. And so it is fascinating to see a lot of these kids, even kiddos I've seen before, that we're well functioning, how quickly that could change by such a big like event to them, such a stressful event. So,
Wow.
Yeah,
and then the
that's
mist
huge.
and not being able to see
Yeah.
faces, like
Right.
all of those things played into it.
Yep. They read faces. That's
It's
how they learn so
yeah,
much.
it's just wild
Mhm.
that people need people. Like children need children.
Yeah.
Like we need
Yeah.
each other, and that isolation aspect, yeah, just what it's doing or what it did is just
Mhm.
that's wild. That's wild that you're seeing it that
Mhm.
way. So
Mhm.
interesting to me.
Mhm.
I love it.
Yeah.
Okay, so you've covered so many different areas of like how you could help people, which is
I love it.
incredible. I know.
So
I'm like,
cool.
and I'm like a chronic someone who had like migraines like my entire life. Shayna, the same thing.
Mhm.
And we both are just testaments of okay, when we started, obviously we both drastically changed kind of like diet and leaned
Yeah.
into that more ancestral eating and metabolic approach,
Yep.
obviously, and different things, and just, upping our calories and upping our protein. And we know all those things helped as well. And
Minerals.
yeah, they're all kind of these
Mhm.
hand in hand. But we both, just even through, and I told you, like, I had started the pregnancy with like extreme migraines. And
Mhm.
then I think I started coming to around week 9-ish, and
Mhm.
my migraines just literally disappeared. And it was just so cool because even in a time where your body is, under stress and growing a human and changing and transforming daily, and you could almost be like, oh, I'm just, it's part of pregnancy, right?
Mhm.
These aches and pains.
Right.
But I would be
Yeah.
telling everybody, like, I feel bomb. Like, I feel so good. And I mean, I said it too every week. I was like, I feel good. You'd be like, what's going on? I'm like, I don't know. I feel great. Like, I feel really good. There's nothing to
I
complain
know.
about. Like, and just, it's just really neat to see of like, yeah, obviously I've experienced it myself. Shannon's experienced it herself with her chiropractor as well. And so it's just really a cool thing that like, okay, yeah, we're living testaments of like we've reaped benefits, and then our children are reaping the benefits because our bodies were that much more well adjusted, like you're saying, prenatally and all that kind of stuff. So
Yeah.
so neat.
So neat.
Such a cool conversation.
But how would someone find you?
Yes.
Like, where are you listed? I don't know how you found her, but how would someone go about
I found you through Dr. Courtney's portal.
Oh, you did.
That's how I found you. But how can people find you? How can they come visit you and be a client of yours?
And a VIP friend and have a photo on the wall. I mean, Archie. It's just a well-rounded experience.
Website is probably the quickest way to get in touch with the team. It's getinspiredchiro.com, and we have a patient request on there. And so we get that directly when someone puts in a patient request. We get that directly to us, and the team will call and set up a consultation with them and explain kind of the whole process, depending on what it's going to require to get started. We have an x-ray suite on site, so kind of depending on what someone's coming in with too. We definitely do nerve assessments on everybody. Some people we do take x-rays when they're not pregnant, but they're an adult, so they can kind of explain the whole process. But we are on Dr. Courtney Cahala's website. We are on the PX website, and then honestly, like all the community pages and stuff, people do a pretty good job of sharing their experiences there too. So if someone wants to get in touch with us, they can find us on social media. We're pretty active there and respond to the DMs there. Or, like I said, our website is probably the easiest, most direct way to get in direct contact with the office, other than calling.
Yeah.
Amazing. And we'll link your Instagram and your website as well. But thank you. This has been such a joy, so informative.
Yes.
We're so excited. This is like our favorite kind of topics, obviously. So we're just so excited that you came on, and we're just, wanting to spread awareness and bring attention to this and talk about it and help people.
Yeah.
So, and you're doing it every day. So thank you so much.
Yes. Thank you so much.
Thank you for having me.
Thanks for listening to another episode of Hey Mama. We're so thankful you decided to join us today, and we hope you go forward in your day feeling encouraged and seen.
Here are a few ways you can connect with our community and support the show. The first way is to share the show with a friend via text or Instagram. You can follow and leave a review on Spotify and Apple Podcasts. And finally, follow us on Instagram at formama birth.
Thank you so much for listening, and we'll see you next week for another episode.